Hello, everyone, and welcome to the Caregiver's Guide to Alzheimer's Disease on ZubiaLive. My name is Winslow Dixon. I'm a holistic health practitioner, published author, and geriatric specialist for the last 10 years, specializing in Alzheimer's and dementia. And tonight we're going to be talking about getting a diagnosis and the early warning signs of Alzheimer's disease. One of the main concerns that aging adults have is memory loss. Is it normal, or could it be something worse, such as Alzheimer's disease? So we're going to discuss what the differences are between normal aging and the warning signs of Alzheimer's disease. So first, let's define what Alzheimer's disease is. Alzheimer's disease is ultimately a degenerative brain disease. The specific brain disease is progressive and causes neurons to stop functioning. Neurons lose connections between each other and inhibit communication, cell metabolism, and repair in the brain's neurons. So basically, Alzheimer's disease destroys neurons and inhibits their connections to one another. This impacts the brain and its ability to create new memories and retain old ones. It typically begins by affecting the areas in the cerebral cortex responsible for language, reasoning, and social behavior. Research is still attempting to discover the exact cause of Alzheimer's, and many theories exist. Genetic, lifestyle, and environmental factors are thought to play a role in the development of this disease. But it is currently believed that Alzheimer's disease is caused by the formation of something called amyloid plaques. And amyloid plaques are groups of beta amyloids, which are peptides, and they destroy the connections between the nerve cells. So that's all, the scientific stuff, but basically that's the breakdown. Scientists think that these plaques attack the neurons and inhibit their ability to connect with one another and ultimately cause the Alzheimer's disease. So that's what the current belief is. But like I said, genetic, lifestyle, and environmental factors are thought to play a role in the development of the disease as well. So let's discuss the early symptoms of Alzheimer's disease. Memory loss, difficulty learning, mood swings, confusion, trouble communicating, and difficulty organizing are typically telltale signs that something's going on. Early stage Alzheimer's patients may also present with signs such as becoming withdrawn, avoiding new people and places, preferring the familiar, and having trouble remembering things. And really what sets Alzheimer's disease memory loss apart from normal aging memory loss is the ability to remember that you forgot something. A lot of times we think, we walk into a room and we forget what we're doing, but then we remember, I was doing something. In Alzheimer's disease, you don't have the brain function that realizes that you forget something. Alzheimer's patients may also become disillusioned, thinking they're in a different time or place, and they may become emotionally unstable when you try to reorient them into reality. That really is the hallmark of the disease, when someone is truly unable to recognize the reality that they're in, whether it be a time or a specific place. That is when you really need to look at, okay, this is different than normal aging. Memory loss, like I said, in normal aging, you have the ability to remember that you forgot something. In Alzheimer's, it's really a disillusion of a time or a place, and you cannot reorient them because those damages have been done in the brain. So in normal memory loss, you acknowledge you forget something. In Alzheimer's, your brain is inhibited and can't reorient properly. So if this is happening to you or a loved one, you need to make an appointment with a physician. Well, what kind of a doctor do you need to see? Well, there are typically two types of physicians that will treat and diagnose Alzheimer's, and these are geriatric psychiatrists and neurologists. So geriatric psychiatrists are doctors who specialize in mental, emotional, and behavior disorders commonly affecting the older population. These doctors can prescribe medications to treat the cognitive and behavioral symptoms of Alzheimer's disease. And neurologists are the other type of physicians that work with Alzheimer's disease, and they specialize in diseases of the brain and nervous system. So both of these types of doctors can aid in the management and the diagnosis of Alzheimer's disease. And it's really important to find a good doctor early on who can work with you to treat and manage your health specifically. This disease is very, it can affect everyone differently. And so when you have a physician that's willing to look at your case specifically, that's who you need to find. And you need to find it early on care can be the best it can be, and we can slow the progression. So, like I said, Alzheimer's disease can impact people in different ways depending on which part of the brain is attacked first. So, this disease management needs to be very patient-centered. So, finding a good physician early on, whether it be a geriatric specialist, a psychiatrist, or a neurologist, is really imperative. And I know that the diagnosis of Alzheimer's disease can be very daunting. So I don't want anybody going away from this depressed. I just think that this is why research, clinical trials, and proper healthcare education is essential. If you or a loved one have been diagnosed with Alzheimer's, don't, I know it's easier said than done, but please take heart that you're not alone. According to the Alzheimer's Association, every 65 seconds, someone in the US develops this disease. So there are resources and there are people that can help you manage this disease. Like I said, there are clinical trials and there are research and there are good physicians that can really walk you through this health journey. So your objective now really is to get an accurate diagnosis and to get a care team to help you and your loved ones manage this disease. So I just wanted to do a short little, video on getting a diagnosis just to kind of give you some tips. Thank you for tuning in. This has been the first episode of the Caregiver's Guide to Alzheimer's Disease. Please tune in for the next installments. Episode 2 will be on choosing a healthcare facility. We're going to talk about some of the different healthcare facilities, what the difference between skilled care, assisted living, independent living. We're going to discuss the differences of those. And episode 3 will be discussing medication and treatment options. And then episode 4 will be discussing on how to care for your loved one at home. So again, thank you for tuning in. This has been the Caregiver's Guide to Alzheimer's Disease on ZubiaLive. My name is Winslow Dixon. Thank you for tuning in.